Hello, everyone. It's Wednesday, April the 21st, and I've got regretfully to report to you that we have hit the 2,800 mark on the total deaths in West Virginia, 15 additional deaths, and I'll ask you for your prayers, and I'll ask you for your absolute letters or anything that you may choose. If you happen to know any of these folks or any of their loved ones, please don't let them ever feel alone. But our 2,786th death is a 71-year-old male from Raleigh County. Our 2,787th death is an 88-year-old male from Raleigh County. Our 2,700 and let me start all over. I may have messed up something. Our 2,786th death is a 71-year-old male from Raleigh County. Our 2,787th death is an 88-year-old male from Raleigh County. Our 2,788th death is a 72-year-old female from Kanawha County. Our 2,789th death is a 61-year-old female from Jackson County. Our 2,790th death is a 71-year-old male from Kanawha County. Our 2,791st death is an 81-year-old male from Berkeley County. Our 2,792nd death is a 67-year-old male from Mingo County. Our 2,793rd death is a 72-year-old female from Morgan County. Our 2,794th death is a 66-year-old male from Cabell County. Our 2,795th death is a 90-year-old female from Wood County. Our 2,796th death is a 74-year-old female from Ohio County. Our 2,797th death is a 90-year-old male from Kanawha County. Our 2,798th death is a 64-year-old male from Jefferson County. Our 2,799th death is a 79-year-old female from Hancock County. And our 2,800th death in West Virginia is a 67-year-old female from Greenbrier County. Who would have ever believed it? 2,800 people we've lost in West Virginia. The youngest of them all that I read today was a 61-year-old. We need to continue to test. If you happen to be 50, 60 years old or older, and you have any symptoms at all, you have got to absolutely go, just as if it were a heart attack or a stroke, go get tested as quickly as you possibly can. Antibodies are available for you, and absolutely they'll save your life, but you got to catch it early. There's been 426 new positive cases in the last 24 hours. We tested a lot. The daily positivity rate was 3.83. Our cumulative positive rate continues to ease down. It's at 5.20 now. We have 7,293 active cases and 139,795 recovered cases. We have 249 people in the hospital, 79 in the ICU units. And again, we're back up to 2 red counties. We've had Berkeley for a good while. We had Raleigh for a good while, and Raleigh dropped out, but they're back now, red. Just as a safety reminder, it's important for you to remember that while J&J, the vaccine with Johnson & Johnson, is paused for right now, we still have plenty of the Pfizer and Moderna vaccines, and there's been nothing that's come up whatsoever in regard to these vaccines, and their safety has been, unparalleled. So we need you to absolutely continue to go get vaccinated, and we'll stand ready to be able to get those shots in your arms just as quickly as you show up, and we can get you in the system or whatever it may be, and we can get that shot to you. The vaccine eligibilities are for all West Virginians 16 years of age and older. I continue to really encourage those that are 16 to 35, and those that are older, their parents, their grandparents, and all those people, to try to encourage our younger people, because we are finding out that they are the ones that are transmitting this thing very, very rapidly. And with all that, if we can get them vaccinated, we'll break this chain. But absolutely, if you want to be assured of us not breaking the chain, probably your option then is to not get vaccinated. You know, I'm going to discuss this with you in just a second, but there's lots and lots of good news out there. But let me just give you the math in just 1 second. You know, the vaccine distribution update, we're at 87.2% right now of first and second round doses. Always the goal is to get to 100%. You know, we have vaccinated to date in West Virginia now a total of 1,179,328. That is 687,045 of first doses and 520,206 second doses. Now, if I could talk to you just 1 second just about this, there's some really great news. You know, we have now reached the threshold where we have exceeded 2/3 of the West Virginia residents that are over the age of 65 with both their vaccine shots, and we have exceeded, you know, 2/3 of the population that's over 65 years of age and having them fully vaccinated. Now, there's been some numbers that we've updated and everything because, you know, we were working off DHHR numbers and everything, but we've gone now with the WVU researchers and the CDC, you know, even the White House and has helped out some. And so we've got a little bit different numbers now. And we think we have a total eligible population in West Virginia today, and that's 16 years of age and older, to take the shots of 1,470,000 people. That's the number now. And we feel really confident that I've been told that that number is dead level accurate. And so if that number is right on the money, we have given to the total number of eligible West Virginians, we have given 50.9%, right at 51% of those West Virginians have received their first dose. So we still got a ways to go. And just like with the work we did in the census and everything, we need your help, West Virginia. Just what I told you just the other day. We need your help. We're doing great. We're absolutely doing good, but we need your help to get there. Because if we could push this number to a fully vaccinated number, today our fully vaccinated is at 37.8. We'll get that. We'll get that to a 51% right there. But we need to get the 51% number. We need to get that to 70. Now, if we can get that to 70, we'll be there. We'll be there. And what that is not 70% of the age 65s. We want the age 65 and older to go to 85%. I think right now we're at 77% right now. It's phenomenal. I mean, that's all there is to it. Remember, what we were hoping for was 75. But now we're all the way up to 77 and on our way to 85. That's really good, really good. But now what we've got to do is we got to get our kids on board. We got to get that 16 to 35 year of age on board. And really then we start really moving this 50.9% and heading towards 70. When we get to 70, these masks and all this stuff will be a memory. Absolutely. When we get there, that's what we want to try to strive for. And so help me out, West Virginians. I really need you. I need you badly. I need you to encourage the kids, the college students, the absolutely very young that you know that are around you, that are workers. Get vaccinated. And we got to do this now. From the standpoint of our manufacturing and church outreach and everything, business outreach, we'll host a clinic wherever you choose to do so, but you got to call us. You got to call us and say, come to our business, come to our church. We'll set up a time when it works for everybody and we'll come, but you got to call us. Our vaccine info line is up, vaccine reminders, on and on. You hear me say over and over. All the science, all the medical experts, everybody in the world says just how safe these vaccines are. You know, like I said before, there was a time not long ago when we had no vaccine, and we would have embraced any level of vaccine. A vaccine that would have absolutely done a 60% effectiveness. Oh, goodness. We as West Virginians, we as the experts, all of us what we would have given for a 60% vaccine. What would we have given? It would have been off the chart. But really and truly, we ended up with a 95% level vaccine. And we did that with Pfizer, and we did it with Moderna. We did it right in the beginning. And we are so blessed to have had that. And a vaccine that for all practical purposes has almost zero side effects. Now, if we'd have given anything in the world for the 60% vaccine, we've absolutely just got to go get our vaccine shots. Please help us, West Virginia. Please. We're close to the finish line, and we can see the finish line. We don't need to just dink around and mess it up right now. Testing maps are up. The drive-through testing, again, we thank Walgreens and Fruith for all that they've done. We've got 11 outbreaks in our long-term care facilities, 5 in our churches in 4 counties, Berkeley, Fayette, Grant, and Nicholas counties. Our church community still continues to step up, and I encourage them to continue to do so in every way. We have 102 inmate cases and 9 staff cases, 32 at the Salem Correctional Center, and 53 at the Southern Regional Jail. All of our guidelines, all the face covering requirement, all that stays where it is. I'd like to clear up one thing. Monday I signed a new executive order to clean up the old ones, to clean up the ones that had run their course, done their good work, and absolutely run their course. I expanded the size of the gatherings. One thing I didn't really drill down on that I'd like to make sure that you know, and it's in regard to this mask. We still have our order in place that absolutely covers our mask wearing in public buildings and all that. I went through the little glitter, analogy that the doc, on one of the news broadcasts was talking about this disease is like that. It's everywhere. You can't get rid of it. It is all over the place all the time. Wear your mask if you go out. Don't wear your mask if you're with your family or people that are fully vaccinated and everything. That's fine. But when you go out, you don't know. You don't know who's vaccinated, who's not vaccinated, all that stuff. And so from that standpoint, wear your mask. The other thing is that we should add to this thing that if you're actively engaged in physical activity, like indoor sports, you do not need to wear your mask if you're actually actively engaged in those activities indoors. I think the rest of it I covered, and so that's all I've got for right now. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Thank you, and good morning, or good afternoon. So following up with what the governor said, I was just on a panel this morning talking at a conference with people from different countries. And we had a physician from Indonesia that was talking about how desperately they would love to have vaccines and how they need vaccines. And as the governor said, the vaccines that we've been blessed to have are incredibly effective and are incredibly safe. And as we see the variants, particularly the United Kingdom variant, continue to spread in the US and spread slowly in West Virginia, we're now up to 402 documented cases of the United Kingdom variant. We know that our window to be able to have our population be protected is right upon us. And as the governor said, this is a real call to action and a call to arms to help make sure that we are protecting ourselves and protecting each other. It's important to note that data from the CDC just came out and looking at 15,000 nursing home residents and staff that have been fully immunized. There's only been 22 breakthrough cases of 15,000 people, which is basically people that have tested positive despite being fully vaccinated. Of those, 14 people were asymptomatic. 2 people had to go into the hospital out of 15,000, and 1 person died. So it just demonstrates, even in our most highly vulnerable population, how effective and how important it is for us to vaccinate, all the people we have. The governor shared good news about our over 65-year-old population, but we all are very much focused at making sure that we are helping our younger West Virginians who are at high risk of being exposed to these viruses and the variant forms of these viruses, to make sure that they and their families are taking advantage of this real blessing we have, which are these highly effective vaccines, and choosing to be vaccinated so they protect themselves, protect their family, allow them to play their sports or do their extracurricular activities. And even if somebody would test positive, being fully vaccinated protects them from having to quarantine. When we look at variants, it's also important to note, and we only have one of the Brazilian variants that we've been able to track, but in the country of Brazil, and I may have said this the last time that I was on the press brief, but it's caused me enough consternation that I just want to repeat this. In the country of Brazil, over half of the patients that are in their ICUs, intensive care units, are under 30 years old. So this virus, these variant viruses are different. We know the initial viruses really attacked our older West Virginians, the Save Our Wisdom campaign, our nursing home residents, and they are still vulnerable to the new variants. But these variants now are targeting a different section, a different sector of our population, younger people. We're seeing the most spread in our 10 to 19-year-old group. So it is really important for us to take advantage of the opportunity we have in West Virginia, as we have before, to vaccinate as many people as possible, slow the spread down, and make sure that we are protecting West Virginia from the same kind of problems we're seeing in Michigan or we're seeing in Brazil, because we have the most vulnerable population that are still at risk as long as we have a sector of our state not vaccinated. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. I'd just like to reinforce a couple of points that the governor made. We've spent the last 2 weeks, DHHR, WVU Analytics team, and the Joint Interagency Task Force working with CDC and others to get an absolute clear picture of where we are with the numbers. We knew that the numbers that we have did not include some of the federal programs that were out there. And that data goes into what's referred to as the CDC data lake. Pulling that together, the governor's pointed out to you the success we've had, particularly in the age 65 and above population, with 2/3 of that population having full vaccination, almost 78% having 1 shot, Within the eligible age population, 16 and above, we've broken that 50% mark on the first shot. But as the governor pointed out, and as we watch him read every day with that look of pain that he has on his face when he has to read out those individuals, we're still not there. And we have clearly hit a vaccine hesitancy point that we've got to get the rest of our fellow West Virginians past. And as the governor again pointed out, we are prepared to go wherever we need to go to vaccinate our fellow West Virginians and get them on board with this and move that. As he pointed out, if we can get to 85% of that 65 and above population, we know from our other data that our death rates have dropped substantially, but we're still losing West Virginians. So I would ask again, as the governor did, civic groups, churches, athletic teams, businesses, please reach out to us, and we have vaccines available, and we will figure out how to get you vaccinated in an expeditious manner. So again, we in West Virginia have changed the face of the way people outside look at us with the outstanding pace and the work that we did getting the population that we had vaccinated in such an expeditious manner. Now what we've got to do is continue to show the rest of the country and the world what we're all about as a people, about taking care of each other and getting on and getting back to normal and showing the world that West Virginia is the place to be. Thank you.
Thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. As we move forward fighting this virus, we cannot forget that testing continues to be a vital component in addressing this pandemic. As a reminder, free testing is still happening across the state. As the governor says, please don't hesitate to get tested, especially if you're experiencing symptoms such as cough, sore throat, runny nose, body aches, or if you've been in contact with someone who is positive for COVID. Testing is free and available to all West Virginia residents, including asymptomatic individuals. Testing soon and identifying this virus early can save your life. We do have antibody treatments throughout the state, but you must test early and you must seek antibody treatment early. Get tested and get vaccinated. This is not over, but we will get through this together. Thank you.
All right, thank you, Secretary. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first from Mark Curtis with Nexstar Media.
Good afternoon, Governor and panel and fellow reporters. Governor, I do have to ask a non-COVID question here because we had a news conference with Senator Manchin this morning, and he talked a lot about this infrastructure bill that's going to be before Congress, $2.3 billion proposed by President Biden. Do you have any concerns about the bill, and what specifically are the needs here in West Virginia and things you hope are in that bill, not only for highways, but for broadband?
Mark, of course, I haven't seen the bill yet myself, and to all of our people are working it, compiling lists and everything else that go with it. I've seen enough and of all the particulars of the bill to just say just this. You remember back not long ago, I probably went a little bit against the grain, surely against the grain from the standpoint of maybe different Republican governors or whatever across the nation. You see, I said at that point in time, on the stimulus package, I said we should either go big or don't go. And my feeling about all of that was just this, is just from a business standpoint, I've never seen a situation to where you continue to try to chase the bleed and you put a Band-Aid on cancer that you never really get there. And that's what we really did. You know, if you go back and you think about the stimulus package, and then I'll get to the infrastructure thing in just 1 second in this story, but even President Trump wanted a $1,800,000,000,000 package, and he and Nancy Pelosi and all the friction and everything we didn't get done before the election. And then we did another little piece of stimulus, and then we said, oh, no, that's not enough. We'll never get there with that. And now we've come with a bigger stimulus package that I was supportive of, not supportive of bailing out these cities and these states or pension plans and all that kind of stuff. But now, in addition to all that, you know, the stimulus package did all kinds of different things. You know, there was some things, pet projects and the pension plans and that kind of stuff that I was adamantly against. But I still believe that we'll be better off in West Virginia by the bigger result than a smaller result. Now, in regard to the infrastructure, because I felt like it's important to lay the foundation, in regard to the infrastructure, I don't have concerns right now. I have more wishes and hopes than I have concerns. In our Roads to Prosperity program, we got after it, did we not? And we've done an amazing amount of work, and I salute, you know, our highway department, our transportation department, and all the great work that they've done. I really believed, and I said it over and over in the briefings, that, you know, President Trump was on course for an infrastructure bill. Now, I hope and pray that our infrastructure bill puts an incredible amount of the resources into infrastructure, not into pet projects and stuff that won't help in any way. You know, if we're going to do $800 billion to an art museum somewhere, not to take anything away from the arts, but that doesn't have anything to do with infrastructure. You know, I am all for us doing all the stuff we can possibly do for infrastructure, whether that be roads or broadband or whatever, bridges or airports or whatever it may be, and that will really, really, really affect West Virginia. You see, you know, Mark, when it really boils down to it, we have so many projects in West Virginia that can really, really be of unbelievable benefit from this. We need to finish Corridor H? Don't we need to finish the Coalfield Expressways? Don't we need to do those? And many, 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 many others in between. So this will give us a real leg up, a real jump. And so from the standpoint of concerns, no, there's not many concerns on my part. Really and truly, what I just hope is with the overwhelming majority of the money, if we call it infrastructure, let's let it be infrastructure. I mean, for crying out loud, that would be my only concern. You know, if we're going to allocate real money for infrastructure, let it be infrastructure.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you clarify what you said about the mask exception? So does indoor physical activity, does that apply to gyms and rec centers as well as youth sports? And if we could just kind of explain the logic behind that. I mean, I know early on, you know, we had a lot of outbreaks and incidents related to gyms. You'd think that would be the one place, you know, where you're, you know, exhaling, putting a lot of droplets into the air. That'd be the one place you should still be wearing a mask. Thank you.
Well, Charles, I would just say this, that a lot of people are having a hard time breathing. You know, if they're running up and down the floor and everything, they're having a hard time breathing. If they're on a treadmill, they may have a hard time breathing. But if you're able to be on a treadmill in a gym and keep your mask on, that's great. You know, as soon as you get through with the hard level of exercise and everything, without any question, I expect you to have your mask back on. But all that is just trying to clarify just that. I mean, it doesn't make much sense, you know, for us to be at a basketball game and people running up and down the floor with masks on. You know, it's just, you know, if we don't watch out, we're going to we're going to have even a whiplash on that. So we got to be careful about that. But I don't remember us being able to track, cases that were spreading in gymnasiums in West Virginia. But I could be in error about that. But I don't think we've done that.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. I have a couple of quick ones. The first one is about masks. Coaches have reached out to me just in the past few minutes. If you could clarify, Governor, about wearing of masks in gyms, does that just apply to the people who are on the floor, and that everyone on the benches, coaches included, still have to wear a mask? Or are we mask free now in gymnasiums when people are in activity? That's the first part. The second one is a little more complicated, so stay with me. If you say you want at least 70% statewide coverage of the vaccine in order to get rid of the masks, and right now we're at 50.9%, that is a long slog to get to, the 1.029 million or whatever the number is. Is it realistic with about 40% of West Virginians thought to not be in favor of getting the vaccine? This all comes down to mask wearing. If masks are effective at keeping us safe, and if the vaccine has proven to be effective in warding off COVID-19, and it has at huge numbers, then at what point do we stop wearing masks if people are fully vaccinated? I think there's a lot of hesitancy for people to wear masks because there's no end line in sight. If it's to stop the variants from spreading, now we're playing whack-a-mole, and something could pop up again in the next few weeks to have another reason to keep the masks on. So is there some type of finish line in place where you could tell people who are wearing masks, who are complying, that once we get a vaccine, once we hit a certain number, that at least those people who are vaccinated can go without them? And those who are not vaccinated, they're kind of taking their own chances into their own hands. If you could give a fixable point, a goalpost where we could get to, that might take away some of the hesitancy of people wanting to wear masks. Thank you.
Okay, Kenny, let me fall back on your first question. And for the life of me, I cannot understand this at all. But, if you're coaching a basketball team, and the kids that are sitting on the bench, or the coach, that is sitting on the bench, or maybe even the coach, if even is up yelling out, plays or whatever it may be that he wants his players to do, or encouraging his players, or getting after his players, whatever he's doing, that coach isn't running up and down the floor. And the kids that are on the bench are not running up and down the floor. And surely to goodness, we understand that running up and down the floor is a whole lot more strenuous than standing up, barking out signals or whatever to your players, or sitting on the bench. And so we absolutely expect those players, just like they did with the NCAA, to be able to wear their mask, as the coaches should, wear their mask on the sidelines. Now, from the standpoint of your other question, in regard to how and when can we get rid of these masks and everything, my comment earlier was just this, there'll be a point in time, and Kenny, it may be at 64.3% or 70%, but I do not want to be misunderstood and say, we've got to get to 70, or I'm not ever going to release us to be able to not wear a mask. We will continue all the way through this thing to listen to all the medical experts, and they'll guide us, not me. They'll guide me as to what is absolutely reasonable and what we should be doing. Now, one thing I really do take issue with is just this. If we have a total eligible population in West Virginia of 1.47 total people that can today take a vaccine. Now, if we could just, for the most part, if we could just do one thing, if we could just round that to 1.50 million people in West Virginia. That's 1,500,000 total people in West Virginia, and it's 1.47. In fact, I'll just go with the 1.47 just for a second, okay? Kenny, at 1.47 total eligible people in the state of West Virginia, if you're right, and 40% of them don't want to take will not take the shot to be vaccinated, I think that number is 588,000 people. I think that number is 588,000 people are refusing to take the vaccine. Kenny, that can't be right. There's no way it can be right. Because if that's right, to be perfectly honest, we're putting vaccines in somebody's arm every day. But if that number's right, we're at the end of the rainbow. We couldn't be possibly putting in arms 92%, 93% of the vaccines that are coming in the state. There's no way. So that number can't be right. The people that are refusing to take this vaccine at a level of 40%, I don't think that number can be right. But Dr. Marsh, add to this, please, because I love the questions. I think the questions are just great. We all want rid of these masks. We're going to have to follow the guidance of the people that are really the super smart medical people. But Dr. Marsh, take over. The only thing I would take issue with, and I want to vet it. I really want to vet it, but I don't think the 40% denial is the right number.
Well, thank you, Kenny, and thank you, Governor. Just briefly, the governor has expressed, I think, the exact right issues. We've talked about this pandemic the whole time as one that is a rare event. And, we've put together our task force through the governor's vision and direction to be able to adapt quickly to what we find. And as we look at where the goalposts stand related to wearing of masks and vaccinations and variant viruses, all I would say, Kenny, is we want to try to give all West Virginians a more concrete set of expectations about when we can remove the mask. And obviously, we will make our recommendations. The governor will make the decisions. But at the same time, I think it's really important for us to reinforce the truth, which is this is an event that continues to unfold. And we are not, suggesting to the governor that we need to follow these types of public health guidances about masks and physical distancing and all that, because we want to be punitive or we want to take any personal right away from anybody. We want to protect people. The governor asked us to come up with strategies to help him save lives in West Virginia, protect our people, keep people out of the hospitals, keep people from getting chronic illness where it's affecting them from their whole life by protecting them. And that's exactly what we're trying to do. So we could say certainly when, X amount of the population gets vaccinated, that's when we can take off the mask. But if things have really changed dramatically, we may well have to adapt our strategies again to protect our citizens, to save our citizens' lives. And as we've gone into this, we've done a really, really great job as a team, as a state, but it's not over yet. And while we don't want to keep looking like we're moving any goalposts, the truth is that we are not dictating to the virus what happens in the future. The virus is dictating it to us. And in order for us to save the most lives, protect the most people, that's the frame that we will continue to follow and recommend to the governor our best recommendations based on our own observations, CDC, what's going on around the country, what's going on around the world. But this is a very complex issue, and we're on crisis management day 400 and something. So it's amazingly unprecedented.
Back to me, Jordan. everyone knows I'm a math guy, and I got to ask a question to the general just one second. But General, how many first round shots are we putting in the arms of West Virginians on a weekly basis now?
Governor, we've dropped down below last week close to 2,000 with the central supply. I don't have those numbers for what we get in the federal pharmacy programs, but we do now have, of the eligible population, based on the total aggregated number, 748,634 people have received a dose.
Okay, give me that number one more time, and I just want to take a second and do 748,000.
748,634 West Virginians have received at least one dose based on all of our aggregated numbers with CDC.
Okay, if let's just go back and walk through this, and General, you stay with me, and Kenny, you stay with me, and anybody that's out there, let's just think just 1 second about this. If we start out with a number of 1,470,000 people in West Virginia that are eligible to take a shot. Now that does not include our children under the age of 16, but if 1,470,000 are eligible to take the shot, okay. Now, if we take from that and we say that 748,634, or let's just use 748,000. 748,000 have received the first round shot. Forget those that are getting the second shot for right now. Now, that's going to leave a balance of, let me just do this real quick. That's going to leave a balance, the way I see this, of 622,000 folks, or is it 722? 722,000 folks in West Virginia that are eligible right now to take the first round shot. And Kenny, if your number's right, that's 588,000 people that are saying we're not going to take the shot no matter what. So if you'll subtract 588,000 from 722, I think you're going to come to a number like 134,000. But really and truly, General, if you're getting in arms of, and that's why I ask, I don't know what that number is every week, but I would surely think that you're getting in, how many total doses are you getting in every week? About 70,000, is that correct?
So, Governor, right now, because of the slow in people taking the vaccine, we have 120,000 doses that we'll have available just this week. So we could hit that one number that you've got almost in 1 week if people would take the vaccine.
Well, that's not really where I'm going. Where I'm really going is to this spot, is if you're getting first round doses in people's arms of that 120,000, if you only put, 25,000 in arms for the first shot, and the second shot is you're putting in, 35,000 or 45,000, and you get out 70,000. You're reporting a number here of 87.2 total administration rate of the first and the second round doses. But what I'm trying to get to is, if all you got left is 134,000 are going to take the shot, we're either going to get there in the next 2 or 3 weeks and then say, well, there's no point in really thinking about it if this number of 40% is right, but I hope and pray that it's not right. And I guess we'll continue to watch it. But the bottom line to the whole thing is, from a mass standpoint, if we've got 588,000 people that are denying this vaccine no matter what, you're at the end of the rainbow as far as people willing to take the vaccine that are going to come, unless we can change their minds, and that's what we need to really continue to try to work on, because we've got at least a population out there that needs our help to try to get them information to where they can feel comfortable enough to take the vaccine.
All right, thanks, Kenny. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. I would like to talk more about the 70% number. If this is the number at which we might roll back the mask requirement and just have more confidence in our situation. I'm wondering why this specific 70% number. If I could get some answers from either of our health officials here, and if we could put a timeline to that. I would think that if we reach 70% by the end of this year, variants have already spread. Some people might even be needing to get boosters at that point. So yes, I would just like more clarification on what happens at the 70% mark as far as transmission, and at what point would we like to reach that?
Okay, Jen, this is me again. Okay, and I appreciate your concern, but everybody dial in to just one thing. And let's just walk through this real slow. I have said repeatedly, there is surely no hard, fast number. The hard, fast information is going to come from the experts. But what is my job? My job is to do exactly what I've done with the people that were over 65 years of age. Those folks were sitting on the sidelines hoping and praying that April would come so they could begin to start getting their tests or their shots. And we started it early, and we started it with Save Our Wisdom, and we started it back in January. And we've gotten, I don't know exactly the number, but it's hundreds of thousands. I think I wish I could just grab that real quick, but somebody will get that for me and everything. But I think it's 250,000 plus people. We have gotten in the arms of people that really didn't know where to turn, and an awful lot of them would have probably died. We have saved tens of thousands of lives because we moved, and we did it, with rapid speed. We've got 2/3 of the amount of West Virginians, that are 65 years of age and older, fully vaccinated, and we've got 77% of them that have had their first shot. Now, June, I want you to really listen closely. An awful lot of my job is to cheerlead, to market, to tell people not to be afraid, to absolutely get them to the point where they will take the vaccine. Now, when you look down at these numbers, and when I looked at them, and I'm very proud of this, when I looked at the numbers and I said, we're hoping like crazy to get 75% of the age over 65, that our medical people, that the great general is telling us, all that, if we could get to 75, Governor, we'll be so happy. And I said, by God, we're not going to stop at 75. We can get to 85. And we're on our way there right now. When I look down here and I see a number like 50.9% of our people, and I know without even moving, because I can do the math, and I've been blessed to be able to do that very, very quickly in my head. Now, I know that number's somewhere around 750,000 people. And I know we've got 1,470,000 people that are eligible. To get another 20% is basically 280,000 people. To get to another 20% or 19% of that number is probably 170,000, 165,000. I'm sorry. I made a mistake there. It's somewhere around 250,000 more people. To get to 20% more of those total is probably 290,000 people. To get to 19% is somewhere 260. Of those people that are out there that haven't had a first round shot, getting rid of these masks is absolutely the goal of all of us, and getting back to normalcy, whether that number is a total at 52%, 58%, 70%. But I really believe, June, that my job is to try to push people as hard as I can to fill out the census form, to be 65 years of age and try to get to 85% vaccination, to absolutely push our people every way I can. Now, to say that, if we don't get to 70%, we'll never take these masks off. Where in the world, where on earth does that come from? All I'm trying to do is push us to do more, push us to do better. Because literally, I know if we can get to a first round dose of 70%, it'll shut this thing down. Now, if you're confused about that, then you're just confused. We know without doubt if we get to 70% of our total eligible population, this thing's over. This thing's over. But I'm not a doctor. And it may very well be that this thing is over at 55, 62. But it's my job to push us. And absolutely, I'm very proud of the pushing that I've done because it's saved a bunch of lives. That's all I got on that.
All right, thank you, June. Next to Junaid Dill with the AP.
Hi, Governor. There's a vaccine clinic at a casino in Charlestown now in partnership with WVU Medicine. It's also open to non-residents. And I'm wondering, is the state opening up more clinics to non-residents to get shots here? And I'm just wondering in general about these kinds of clinics, what the benefits are and what the state hopes to get out of them. Thanks.
Junaid, I'm gonna have to pass to General Hoyer, but I always appreciate your fair questions and good questions, and I'm gonna pass to our general. Maybe he can, our focus ought to always be on West Virginians first and foremost, but we do have additional vaccine now, and surely as we have people traveling back and forth and coming in and out of jobs and stuff like that, we'd like them to be vaccinated. But General, if you could add to that, please.
Yes, Governor. I was not aware of any data that we put out to open it up to non-West Virginia residents, other than those who work in the state of West Virginia. So someone who works in the Eastern Panhandle, for example, at the air base at Martinsburg, I think about 50% of the men and women who are part of the total force of the air base who belong to West Virginia on that National Guard basis are from other states in the surrounding area around the Panhandle. So not aware of anything we've done to open it up just broadly to anybody that wants to come from another state to get a vaccine, but it is open to those who work in West Virginia who reside in other states.
All right, thank you, Junaid. Next to David Beard with the Dominion Post.
Hi, I wanted to ask about the getting the younger kids vaccinated as we move along. I kind of remember when we talked about reopening the schools that we said that it was up to age 15 that were less likely to spread, and that's why we kept the high schools on the MAP system for a bit longer than the middle schools and elementary schools. But I think today I heard that kids ages 10 to 19 are spreading. So I wonder if we could talk a little bit about how that number got moved down about 5 years for kids who spread. Thanks.
I think, Dr. Marsh, you've got to answer this, please.
Thank you, Governor and David. So when we looked at the data that came out of Iceland and that have come out of other studies, that younger children were half as likely to catch COVID or spread COVID, that was really pre-COVID variants. And as we see the United Kingdom variant become the most common form of COVID-19 in the US, and we see it starting to grow in West Virginia, we know that this particular variant and the other variants, including the one that was first found in California, or the two in California, the one in South Africa and the one in Brazil, are more easily transmissible. In other words, spread in a more efficient way, 50% more able to spread. And that includes to younger people. So the comments that I made earlier are really related to this growth of these variants. It's changing the natural history of this virus and this pandemic to the level where we're now starting to see younger people not only get infected and perhaps be able to transmit or infect others more easily, but also potentially have the opportunity to be sicker. And as I said, in Brazil, with the Brazilian P1 variant, over half of the intensive care unit patients now are under the age of 30 years old, which is just stunning. So this now is a virus that impacts younger people. But importantly, we are tracking very, very carefully in classroom spread and with the appropriate mitigation measures. And we hope, with more vaccinations, but particularly with the aggressive vaccination of teachers and school service personnel, we have seen really no spread appreciably in the classroom under those situations of good distancing and mask wearing and being careful. The spread that we've seen have been in extracurriculars and in social situations where it's now more spreading in younger people than it's in older people, but the classroom still appears very safe.
All right, thank you, David. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding the slowdown in vaccinations, according to the CDC's Vaccination Administration tracker, we're now down to 47th in the U.S., down from 43rd on Monday. So our numbers seem to be slipping. How did we go from being the envy of the nation to one of the lowest vaccination rate states, and how do we reverse that?
Well, Phil, let me jump in and just say just this. I think that you've got to go back and consider the population and do the math. I just keep doing the math. If in fact we've got a total population in West Virginia of, I think 1,793,000, I think that's the right number. And if you're at 1,793,000 and you say the total eligible is 1,470,000, all the rest of them are kids that are under the age of 16, and you say you got 1,470,000 that are eligible, and in our situation right now, we've gotten in the arms 50.9% of those that are eligible. Now, there's a percentage out there that's not going to take it no matter what. And then there's the delta in between, and that's what we've got to work on. And so, I just like I said before, I'm a math guy. I love the math and everything else. I'm not very good at many things, but I'm pretty daggum good at math. And so while I was just sitting here, and I'll talk about this in my closing remarks, but I was just making up, just a little, note to myself. And the note to myself is just this. And it was beat 588 bad. And what it means is just this. Kenny Bass came up with, it said that 40% of our population won't take the vaccine no matter what. Now, that's not Kenny saying that. He's saying that that's what people are implying. My feeling is just this. He may be right. He may be exactly right today. And if he's right, we got a problem. We got a problem to be able to really get after it and educate more and more and more of our folks. But my goal now is going to be beat 588 bad. Because if we don't, we're not going to get rid of these masks. It's going to be really, really, really tough, and our experts are going to be hesitant and hesitant and hesitant. I want the mask gone. But absolutely, we can't stand 40% of our folks not wanting to take the vaccine. So what do we have to do? We got to double down. We got to double down and we got to work it. We couldn't stand 60% of our population being counted in the census. We couldn't stand, 80% of the people that are in our nursing homes taking the vaccine. We couldn't stand those things. And therefore, we worked it, did we not? Now what we got to do is beat 588 bad. We've got to beat it really bad. And so that will be my next goal, and that's what we'll do. Phil, you're probably right, and we have slowed down in West Virginia, but we don't have a pool of people. We don't have a pool of people because we were so good at how we administered everything that we absolutely used our pool of people. Now we've got another challenge. We've got folks that are absolutely turning the vaccine down and deciding they're not going to take the vaccine. And to be perfectly honest, the Johnson & Johnson situation, by them pausing the Johnson & Johnson vaccine and pulling it off the shelf, not that we need the vaccine, but absolutely it scared a lot of people.
All right, thanks, Phil. Governor, back to you.
Okay, now remember, these are my new words. Beat 588 bad. 588 represents 40% of our eligible population. And again, I thank Kenny for even bringing that to me even more vividly than what I had really thought. So I think it's a great, great comment that Kenny made, and all the follow-up is great just as well. Whether it be Phil or June or whomever was, talking about it and everything, great follow-up. Now, but here's the whole thing now, and I want you to pay really close attention to just this. How many of your family or your loved ones are going to have to die? How many people that you know are going to have to die for us to awaken to the fact that these vaccines are safe, and absolutely all of our medical community and all the people that you've trusted and you trust all your life, each and every day, how many are going to have to die before you really believe, yeah, I've got to go get vaccinated? I hope and pray in every way that number won't continue to just escalate and escalate and escalate until you believe. Absolutely, without doubt, we have some people that are hesitant. The Johnson & Johnson situation scared folks. I understand it. I got that. But absolutely, you have got to really continue to trust all these people that are really, really on their game. You've done it for your entire life. You get, a bad medical, symptom or whatever. You have a feeling of a heart attack or a stroke. You run to the very people that are telling you what to do here. And you run to them for assistance in your life, and those very same ones that you have entrusted your entire life are telling you, you got to get vaccinated. And you got to really help us with the kids that are 16 to 35 years of age. You got to really help us. Now, I would ask you now to ask one another the question that I just posed. Ask your family members, how many are you going to have to see die before you really, truly decide to go get the vaccine? Ask your fellow employees the same question. Ask your employer the same question. Ask your pastor the same question. And then follow up with this question. You know, boss or pastor or our family members, but especially in our businesses and our churches, boss, how many are going to have to die before you organize with the state or with the National Guard or DHHR to come in and absolutely vaccinate our congregation? How many are we going to have to lose before somebody will make a call? Somebody will call and at least make it easier for people to get their vaccine. A lot of people will take the vaccine today, but they just can't make time for it in their life because they can't get off work, they can't afford to miss work, and they don't want to miss church, and therefore all the things that are going on in their lives, they just absolutely would take the vaccine, but they just don't have time. Well, I would just say just this. Please help us. Please just help us to be able to schedule the clinics. Please help us with the younger people. Please help us beat 588 bad. You can do it. I know you can. So this is our next goal, West Virginia. Help me. Thank you so much. God bless you.